What about sex hormone binding globulin, testosterone? There's thoughts that if you eat no carbs and only eat meat, that your SHBG goes up, and then therefore your testosterone drops, and that's why we need carbs again to support this area.
So first of all, sex hormone binding globulin absolutely is higher in people on carnivore diets. It does go up. We monitor this. We can see it. It's very, very clear to see and very easy for us to see. So the question is this a problem? The old thinking used to be that sex hormone binding globulin would bind to testosterone and that would prevent the testosterone from being inactive. So the truth is, we now know that sex hormone binding globulin bound to testosterone still has physiological activity. So this fear about elevated sex hormone binding globulin basically preventing your testosterone from having any physiological effect, that's not true. Further to that, if we have a look at what we call the lean mass hyperresponder phenotype, so I'm sure your listeners will be familiar with Dave Feldman. So that's when people go on ketogenic style diets and their LDL cholesterol goes up, their triglycerides go down, their HDL cholesterol goes up. Yes. So as a part of that phenotype, I add sex hormone binding globulin. So it's my observations that when people start having those high levels of LDL, almost always they're having a very high level of sex hormone binding globulin. So it's not just isolated to carnivores, but I suspect that because carnivore is such a low carbohydrate and can be a high fat diet, that we're seeing that lean mass hyperresponder phenotype. And I certainly don't see any problems with that. There's multiple things that make sex hormone binding globulin going up and down. But if I'm seeing it as a picture of that improved lipid status, that higher LDL, higher HDL, and lower triglycerides, and also LDL, then that does not impair athletic or physical performance at all. So what we do see is that people with chronic inflammatory conditions, and one of the most common reasons people go on a carnivore diet is to manage inflammatory bowel disease. Well, these kind of conditions are usually associated with very low testosterone levels. The usual pattern we see is that when people eliminate inflammatory conditions, that their testosterone levels are restored to where they should be. Testosterone has what we call diurnal variation, and it will spike. So if you measure it at different times of the day, you'll have a different level.
Yes.
So one of them was a chiefly carnivore tribe, which we know to be the Maasai. They consume a lot of meat and a lot of dairy. And they found an adjoining tribe called the Akakuyu, who was chiefly vegetarian. And there was a little bit of intermixing between these tribes by marriages and things like that. So genetically, they were fairly similar. So physical measurements showed that full-grown Maasai male is on average 5 inches taller and 23 pounds heavier than the full-grown male Kikuyu. And his muscular strength, as determined by the dynamometer, is 50% greater. Marked differences were found in the incidence of disease in the two tribes. Bony deformities, dental caries and anemia, pulmonary conditions and tropical ulcer being much more prevalent among that Akakuyu. On the other hand, intestinal stasis and rheumatoid arthritis were more common amongst the Maasai. The take-home message, I guess, is that a meat and dairy diet, on average, leads to you being far healthier, far stronger, far more robust than a vegetarian diet. But the interesting things is about this intestinal stasis, constipation, and rheumatoid arthritis, which is an autoimmune disease, being more common in the Maasai. And this comes back to two things. So have you ever heard of something called casomorphine?
Yes.
So this is a chemical. It's basically an opiate-like peptide that's found in dairy. And if anybody has ever prescribed morphine, when I was in medical school, we were taught that the hand that writes the script for an opiate also writes a script for a laxative. Why? Because opiates cause constipation. So this isn't very well known, but it is very obvious to a lot of my patients who are constipated that when they eliminate dairy from the diet, you're removing this constipatory effect of the casomorphine. So absolutely, dairy contributes to constipation. 80% of the protein fraction within dairy is something called casein. And casein can cross-react. It has cross-reactivity with gluten, which we know can be an autoimmune trigger. So there's increasing evidence that dairy in vulnerable individuals can trigger autoimmune issues, the likes of rheumatoid arthritis. And this is why many patients, when they eliminate gluten and dairy from their diet with autoimmune disease, they improve significantly. It wasn't pasteurized, it wasn't homogenized, it was natural milk straight from the cow. So, and it was A2. So people who think that you can get raw milk and A2 milk and that's going to avoid any potential adverse effects of dairy consumption, it's not borne out by the science.